Tonight, we're looking at the biggest issues impacting Americans today. They all evolve around health care. Maybe you've been hit with a serious illness in the past. I know I have, had a heart attack years ago. Maybe a loved one, a parent, or even a child. If you've got good insurance, great, good for you. But if not, then what? The current health bill in the Senate, it cuts Medicaid. It ends penalties for people who do not buy health insurance. It slashes Obamacare. The Congressional Budget Office said today this plan would leave 22 million people uninsured by 2026. That's only 1 million less than the House bill. The Senate bill reduces the federal deficit by about $321 billion. Now, a vote is planned before they go on recess, before the Senate goes on recess for the 4th of July holidays. Now, tonight we go off script with 4 women directly impacted by this bill and what's happening on Capitol Hill this week. Gina Gavlak has type 1 diabetes and is the former chair of the National Advocacy Committee of the American Diabetes Association. Julianne Edwards, a recent law school grad, and she's gone through treatment for cancer. Katie Mushin, is that right?
That's right.
Is mother of a child with a congenital heart defect, and Kathy Webster, past chair of Women Heart, the National Coalition for Women with Heart Disease, and diagnosed with a congenital heart disease at age 4. Ladies, let me ask you, let's start off here with you. Your reaction to the Senate bill today.
Yeah, and thanks for the opportunity to be here, Bruce. What's really interesting is, and scary, is the fact that as somebody with a pre-existing condition, so I've lived with type 1 diabetes for 37 years, I've been incredibly fortunate to have good health insurance coverage, so have been able to avoid all of the different costly complications, both physical and financially costly, that go along with uncontrolled diabetes. But with the items that are in place, with the bills, with the healthcare legislation, the fact that pre-existing conditions are once again being introduced. So whether it's diabetes or other pre-existing conditions, the fact that insurance premiums can once again rise to costs that are incredibly unaffordable, that would prevent people from being able to actually purchase insurance and be able to do whatever they needed to do to manage their disease, and in this case, diabetes. And one of the other incredibly important pieces is the essential benefits package. And the fact that the essential benefits package, which I think sometimes people don't realize how important that is. And the wording of the package is so crucial. It's essential for a reason. It's doctor's appointments, medications, the opportunity to meet with educators for diabetes education, whether it's a dietitian or a nurse educator. If people don't have access to these things, they're not going to be able to successfully manage a disease like diabetes, which is incredibly complicated.
Mm-hmm. What's your story?
Well, my story, when I saw the bill today, it just brought back my experience with the ACA and how fortunate I was, and how I can look back and see how it was there for me. When I was diagnosed, I was 26 and I was on my parents' insurance.
What if you didn't have insurance?
Oh, if I didn't have insurance, I would not have been covered for the surgery that saved my life. When I was diagnosed at stage 4, which is the latest stage of cancer that you can be diagnosed with, and immediately had to go into chemotherapy. I was only halfway through chemotherapy when my policy expired, and I was able to get another one thanks to the Affordable Care Act.
Okay. Let me move on, and I'll come back to you. Katie, what would you say to those senators who are on the fence right now, haven't decided what to do? What would you say to them?
I would say that my 4.5-year-old son was born with a pre-existing condition. This isn't something he did to himself. This isn't something that he caused. This child was born with half a heart. And without insurance and without Medicaid, 50% of children with a congenital heart defect receive Medicaid support. Because even with good insurance, even with 2 parents working, the ability for families to support the premiums, the supplemental care that these children need, so that they can go on and contribute, is nearly impossible.
Kathy, some senators who are for this will look at the deficit side of this. This reduces the deficit by $321 billion. What would you say to that?
I'd say vote no. I just, as a patient, as a woman with heart disease, we have 48 million women who are at risk or at risk of heart disease. We can't afford to allow something like this to go through. But also as a voter, we haven't had, we elected 100 senators to go to represent us, and I am not feeling at all like I'm being represented. We haven't had any open hearings. We haven't had town hall meetings. We need a voice in this. They need to listen to the patient groups, the medical groups. They can't just what did it end up being? 13 men behind closed doors that came up with this.
Do each of you believe that the government has a responsibility to make sure that everybody has health insurance? Or in this society, capitalistic society, is that not a primary responsibility for the government?
I would have to say, I mean, coming from a cancer background, you know, nobody asks for cancer. Nobody can pull themselves up by their bootstraps and you know, get rid of their cancer diagnosis. The same way that they can't get rid of a heart defect or type 1 diabetes. These are things that people get stricken down by. And for us to say, well, you're on your own, that's not the country that we live in.
Mm-hmm.
And I think it is incredibly important for our members of Congress to be able to give a voice to people. A lot of people who, if you look at one of the biggest things that is on the chopping block to be gutted is Medicaid expansion. And Medicaid expansion, my background in emergency department nursing, but also as a president of a charitable clinic, Medicaid expansion has provided 24 million people with coverage.
Right.
And the fact that that coverage is going to now possibly be taken away is unconscionable.
Okay, all right. We're going to continue this conversation, needless to say, after today, because it's going to go on.